What would you consider to be the key agencies within a MASH?
Yeah, it will be children's social care, police, health, education, and early intervention service.
Right.
Early intervention service, because most of your green cases, if you are regging them, they have to go somewhere. They don't necessarily need a social care intervention, but they need family support, they need that early intervention. So you can say, this is a mom who is struggling with children under 5, 3 children under 5. The best place they can be supported is within the community, rather than opening a social care case on them. So early intervention service is key to the functioning of the MASH, because most of those cases you are saying, where do they fit, where do they sit, rather than saying everything is children's social care, an assessment.
Right.
Okay. Yeah. Another key service is domestic violence service. Many local authorities name them in different names, but a domestic violence service offers that opportunity for early intervention, going in early when you receive your mailing, your first one, your second one, where there is low-level domestic violence incidents, arguments, but that's how it starts. They will build. So you go in early when you receive that referral, and someone links with mom, links with dad, perpetrator, working with the perpetrator earlier on, rather than letting it build on and build on.
Absolutely.
So a domestic violence service is key. So we have children's social care, police, health, education, early intervention service, and domestic violence service.
And they all have to be working with each other?
With each other, but also 100% dedicated, committed. Those 6 have to be sitting together, co-located, working together with no...
So they have to be in the same room?
Same room, with their own systems, yes, but with working together as a MASH, because in some areas they are given an option to come work 2 days, work 3 days, but once you start having those options, some will opt out. Or
someone doesn't turn up.
Someone doesn't turn up, or some will say, let's have telephone contact. That has not worked out well in many local authorities, because what you are saying is, you can sit in your office, we will call you, but we are saying we are dealing with MASH here and there. We have 4 hours to get this information. By the time we call that, maybe they are not in, maybe you will be asked to speak to duty. It's not the same. So I would say the learning I've picked up from working in other different local authorities is to have key services together, face to face, doing this work.
Right.
Of course, there are other services that can be optional.
And that's important, is it?
That's important. Yeah. You can look at their role within MASH. For example, housing, youth offending services, drug services. They don't need to be there full time. Yeah?
But so as you said, you have your key partners, then you have your peripheral partners, yes. And it's important to understand where they all fit in with each other.
It's important to understand what they are contributing, where they fit in, and how much are they expected to bring in, because there is no point in saying you need a drug officer there 5 days a week if your cases are not indicating you have drug issues more than DV. So depending on your local authority, you may have drug issues more than domestic violence issues. So you have to build your teams according to what is the most pressing need.